Welcome to the Legacy Holistic Health Coach Training Module 38. In this module, we're going to discover what cardiovascular disease is. We're going to learn an understanding of what the symptoms and the risk factors are. And then we're going to go into discovering some treatments to cardiovascular disease. The word for this particular module, as there's a word for every module, is thrive. When we talk in terms of making sure that we are able to thrive, it has been said that when the heart is healthy and when the heart is functioning properly, the entire body thrives. And this is true because the heart is literally at the center of the body, not just physically, but spiritually as well, and the heart, or metaphysically as well, and the heart is that part of us that can function independent of anything that we do. That's just how important its function is to getting nourishment, to getting blood and nutrients out to all of the cells of the body so every part functions properly. Now, heart disease describes a range of conditions that affect the heart. Diseases under the heart disease umbrella include blood vessel diseases, such as coronary artery disease. They also include heart rhythm problems or arrhythmias and heart defects that people are actually born with, which are also known as congenital heart defects. And this is just a few of the many types of diseases that are under the umbrella of the word heart disease. You might also hear heart disease used interchangeably with the words cardiovascular disease or CD. Let's take a look at what's actually happening at the level of the heart when we're talking about heart disease. Now, what I want you to be able to see is that any type of heart disease in and of itself results in some kind of failure in the normal functioning properties of the heart. What ends up happening is certain parts of the heart, whether it's the valves or whether it's some of the chambers, can be affected. When we're looking in terms of what actually happens at the level of the heart, when there is too much demand put on the heart is a muscle. And so over time, it grows really, really thick muscle to try to accommodate the demand of the blood going in and out and circulating it around the body. In times of stress, the heart beats harder. In times of when there's hypertension or other comorbidities, the heart has a tendency to increase its contraction and increase its force. And over time, the chambers and the muscles surrounding those chambers and even the valves begin to change. And as a result, what can happen is if the heart, for whatever reason, starts to weaken, we will begin to see, one thing that will happen is, for example, this is a normal sized chamber of a heart versus how much bigger this one is. You can immediately see how thin the muscle is compared to this area where the muscle is nice and it's thick and it's healthy. This, what you're looking at, is called heart failure. It is when the chambers of the heart start to really dilate out to try to accommodate more blood. And over time, the contractility and the force of the heart can be not as effective and not be as efficient as it could be in getting blood supply out. And so in order for the heart to accommodate all of that volume, one of the things that happen is what we call a dilated cardiomyopathy. And we're going to talk a little bit about that because all it is the heart expanding to try to accommodate the demand that's being put on the heart. One other reason why more demand can be put on the heart is not just at the level of the pump, which is the heart itself, because the heart pumps blood out to the body, but also at the level of the pipes. Any of the blood vessels that are leading to and from the heart can also be affected, just like what you see here in this particular picture. What tends to happen is plaques start to build up in the arteries and it narrows the passageway that blood supply is able to get through. As a result, even some of these plaques can begin to rupture and even hit the bloodstream, causing other disease issues like strokes or heart attacks. If these plaques were to lodge into very, very tiny vessels where they wouldn't pass, then they can cause strokes or mini strokes, or they can cause heart attacks. Some other things that may happen is because blood supply isn't able to squeeze by or get by, blood will start to pool in certain areas. Now, as soon as blood starts to pool in a certain area, it immediately turns on the clotting cascade. And as a result, many clots and even big clots start to form. And then over time, if these clots form, they can actually and can rupture and completely block arteries, and this causes blood to backflow, and it also causes decreased blood supply going out to the extremities or out to where it was supposed to be going away from the heart. This backup of blood causes the heart itself to dilate and become bigger because the volume isn't being pushed out the way it needs to be. It's being stopped at the level of the pump because the pipe is blocked. And as a result, the heart has to expand and get bigger to hold the slowing volume that's not getting out or that's blocked. Let's talk about some top players when it comes to different groups of cardiovascular diseases. Now, in your notes, you have an extensive list of different types of heart disease. But for the purposes of this module, we are going to cover the top 8 cardiovascular diseases and what they mean. When it comes to angina, angina is also known as chest pain. Angina is the medical term for chest pain or pressure, and it's usually due to not enough blood flow to the heart or to the heart muscles. So anytime something is blocked and not enough blood flow gets to it, whether it's an extremity or whether it's the heart, it may start to cause tingling or even pain. So the chest may feel very heavy in a person, or they may say it feels like an elephant is sitting on their chest, or it can come as throbbing pain at the area of the heart. And so when this starts to happen, it is known as angina. Myocardial infarction, also known as MI, or heart attack. Myocardial infarction is commonly known as a heart attack, and it occurs when blood flow decreases or stops to any part of the heart, causing damage to the actual heart muscles. Now, when it comes to myocardial infarctions, we want to make sure that if a person is having a heart attack or has history of a heart attack, that we actually know about it. We also want to know if they have family history concerning this too. The next disease process is called stroke. Stroke is a medical condition where poor blood supply or poor blood flow to the brain results in cell death. And so when blood flow stops to the brain, immediately brain cells begin to die within seconds. And so as a result, we can start to see lack of function in the brain show stroke symptoms or stroke signs in a person who's experiencing or has experienced a stroke. Now, some people recover from a stroke and some people don't, but the reason could be because of the type of stroke, how long the person had the issue, and several different things can play into why certain people recover from stroke symptoms and others do not. The next type of disease process is actually called heart failure. Now, heart failure is also known as a chronic heart failure or CHF, and it's when the heart is unable to pump sufficiently to maintain blood flow to keep the body's needs. The next one is called hypertensive heart disease. Now, hypertensive heart disease includes a number of different types of complications, but all of these complications result from having extended high blood pressure that can begin to affect the heart itself. The next type is called rheumatic heart disease. This type of heart disease is caused by rheumatic fever, and it is an inflammatory disease process that can involve the heart, the joints, the skin, and even the brain. Cardiomyopathy is exactly how it sounds. It is a group of diseases that affect the heart muscles. Early on, there may be a few or no symptoms at all. And then over time, it can turn into what is called dilated cardiomyopathy, where the chambers of the heart begin to expand and the muscles begin to be very, very loose and not as strong and able to actually allow the heart to contract. Heart arrhythmias. Heart arrhythmias are also known as arrhythmias, dysrhythmias, or irregular heartbeats. Is a group of conditions in which the heartbeat is irregular, too fast, or even too slow. When this happens at the level of the heart, it makes the heart actually quiver inside of the chest other than just effectively beating to get blood out to the entire body. When the heart starts to quiver inside of the chest, the heart has ineffective functioning for the rest of the body. As a result, very little blood flow is able to get to the brain and to the other extremities. Now that we understand some of the disease processes under the umbrella of cardiovascular disease, let's take a look at some of the symptoms. Be sure to refer to your notes to learn more about things like congenital heart disease, valvular heart disease, carditis, aortic aneurysms, peripheral artery disease, thromboembolic disease, and venous thrombosis. Now, when it comes to the symptoms of heart disease, the symptoms depend on what type of heart disease a client has. Symptoms of heart disease in the blood vessels are atherosclerotic disease. Cardiovascular disease symptoms may be different for men and women. For example, men are more likely to have chest pain, while women are more likely to have other symptoms along with chest discomforts, such as shortness of breath, nausea, and even extreme fatigue. Some main symptoms when it comes to heart disease are chest pain and chest tightness, and chest pressure and discomfort, which is called angina, shortness of breath or difficulty breathing, pain, numbness, weakness, or coldness in the legs and arms because of decreased outflow from the heart to the extremities, pain in the neck, jaw, upper abdomen, or even radiating pain in the back. Now, these are your main symptoms when it comes to heart disease. When we're talking about the group of diseases that have to do with the arrhythmias, or where the heart is skipping beats, or where the heart is quivering, and where the heart is not getting what it needs to effectively pump blood out to the body, instead of having this beautiful rhythmic heartbeat with blood going out to the body, it tends to quiver or flutter inside of the chest, not allowing a nice pump for blood to be able to effectively go out to the extremities. When this happens, there are some other symptoms that we want to look for in clients. Now, clients might not be diagnosed with cardiovascular disease until they have a heart attack, angina, stroke, or even some form of heart failure already. So it's important to watch for cardiovascular symptoms and discuss concerns with the doctor if you see them. Cardiovascular disease can sometimes be found early with regular evaluations. Now, when it comes to the arrhythmias, some symptoms that people might experience are fluttering of the heart in the chest. They may experience racing heartbeats or tachycardia. They may experience slow heartbeats or bradycardia. Tachy means fast and brady means slow. Chest pain or discomfort, shortness of breath, lightheadedness, dizziness, fainting, syncope, or near fainting. Now that we understand some of the heart disease symptoms and signs to look for when a person has a heart rhythm that is off, when it's too tacky, or when it's brady, let's take a look at what happens when backflow to the heart is outflow from the heart is blocked, and when the heart begins to dilate out. Remember, when a heart begins to dilate and the ventricles get weak and they get widened, the muscles around the ventricles become very, very weak and stretched out. And as a result, blood begins to pool and kind of sit in the heart and unfortunately starts to begin to clot. Now, there's several ways to begin to treat this, and we'll talk about that a little bit later, but let's discuss some of the symptoms that you'll see if a person has dilated cardiomyopathy or a history of dilated cardiomyopathy. Now, they include, in the early stages of cardiomyopathy, the person actually may not have any symptoms, but as the condition worsens, you'll see some of the symptoms listed on your screen, which is breathlessness with exertion or at rest, swelling of the legs, ankles, and the feet, fatigue or being too tired to do anything, irregular heartbeats that feel rapid, pounding, or even fluttering, meaning that an arrhythmia is also present, dizziness, lightheadedness, and even fainting. Now, there are some less serious congenital heart defects that are often not diagnosed until later in childhood or during adulthood. Signs and symptoms of congenital heart defects that usually aren't immediately life-threatening may include people easily getting short of breath during activity or exercise, easily tiring during any type of activity, swelling in the hands and swelling in the ankles, and even swelling in the feet. Now that we know some of the signs and symptoms that have to do with congenital heart defects, that have to do with dilated cardiomyopathy or congestive heart failure, and that have to do with just basic heart issues and abnormal heartbeats as well, let's take a look at some of the signs and symptoms that have to do with heart infections. Now, endocarditis is an infection that affects the inner membrane that separates the chambers of the heart and the valves of the heart, which is called the endocardium. Now, this part of the heart can actually get infected and it can be almost detrimental to the client or to the patient. And so when we understand what's happening with these infections, we can also look at what's going on with the symptoms and bridge the gap between the two. Symptoms of this include fever, shortness of breath, weakness or fatigue or easily tiring, swelling in the legs or the abdomen, changes in the heart rhythm, a dry or persistent cough, skin rashes, or unusual spots may also be present. So we want to be careful with this. Now, there also are symptoms that have to do with valvular disease, and they include fatigue, shortness of breath, irregular heartbeat, swollen feet or ankles, chest pain, and fatigue. You'll notice that many of these symptoms are the same across the board, whereas some of them vary just a little bit. But when it comes to cardiovascular disease, anything that causes backflow to the heart may also cause backflow to the lungs. Because remember, the flow of a drop of blood through the entire circulatory system has to go through the lungs to pick up oxygen before it comes back to the heart and gets pumped out to the entire body. When something is blocked at the level of the heart, or when something is blocked with blood going out to the body and there's a backup at the heart, there is also a backup at the lungs. And so this backup in fluid and backup in blood flowing out causes shortness of breath. Let's take a look at when it's appropriate to begin to see a doctor. Seek medical attention if the person has these types of disease symptoms. Chest pain that is not alleviated with aspirin, shortness of breath, or even fainting. Heart disease is easier to treat when it's detected earlier. So talk to a doctor about the concerns regarding any type of heart health. If a client is concerned about developing heart disease, have them speak to the doctor about steps that they can take to reduce heart disease risk. This is especially important if they have a family history of heart disease as well. And speaking of risk factors, let's go ahead and take some time here to look at what could be going on with the risk factors concerning heart disease. Now, there are several risk factors listed in your notes. And for the sake of time, we are going to stick to the main ones that are here. And so the main risk factors and causes are high blood pressure, which when blood pressure is not controlled, it can result in hardening and thickening of the arteries, narrowing the blood vessels through which the blood is able to flow. Diabetes is also a high risk factor as well. Individuals with diabetes increase the risk of heart disease. Both conditions share similar factors such as obesity and even high blood pressure. And remember, this is also a disorder that is linked with obesity, diabetes, hypertension, and heart disease. High blood cholesterol levels. High levels of cholesterol in food can increase the risk of formation of plaques and atherosclerosis. Obesity. Excessive weight typically worsens other risk factors as well. Family history is also a risk factor. A family history of heart disease increases the risk of coronary artery disease, especially if a parent developed it at an early age, meaning before 55 for men, male relatives, and such as a brother or father, and 65 years old for a female relative, such as a mother or a sister. Poor diet, a diet that's high in fat, salt, sugar, cholesterol, can contribute to the development of heart disease and worsening of heart disease. Smoking, nicotine constricts the blood vessels, and carbon monoxide from smoking can damage their inner lining. This makes them more susceptible to atherosclerosis, heart attacks, and more common in smokers than in non-smokers. Other Other risk factors include gender, age, certain chemotherapy drugs and radiation therapies for cancer, physical activity or lack of physical activity, stress, and even poor hygiene. Not regularly washing the hands and not establishing other habits that can help prevent viral and bacterial infections can put you at risk for heart infections, especially if the person already has an underlying heart condition. Even poor dental habits also can contribute to heart disease. So it's important that we take care of the entire body to keep the center of everything healthy and flowing well. Now that we understand the risk factors concerning heart disease, let's take a look at what we need to look for and some different ways to diagnose heart disease. The test that the person needs to diagnose heart disease depends on what the doctor thinks the person may have. No matter what type of heart disease a client may have, the doctor will likely perform some kind of physical exam and ask about the personal and family medical history before doing any of these tests. Besides blood tests and chest x-ray tests to diagnose heart disease, other ones include things like an echocardiogram or an ECG. You may also see this listed as an EKG, and it records these electrical signals that can help the doctor detect irregularities in the heart's rhythm and the heart structure. Now, you may have had an EKG you can have an EKG while you're at rest or while you're exercising. If the person is asked to exercise, like walking or running on a treadmill while an EKG or an ECG is being done, they can also look at if the person tires easily or becomes short of breath, or all those different things that lead to the symptoms of heart disease. Holter monitoring is a portable device a person wears to record continuous ECG or electrocardiogram activity. The person usually wears the monitor for 24 to 72 hours. The monitor is used to detect heart rhythm irregularities that aren't found during a normal EKG exam. For example, a person would have a Holter monitor that they wear to bed or that they wear continuously to catch any dysrhythmias and anything that happens when they fall asleep. During these times, a normal EKG is usually not done. An echocardiogram is the non-invasive exam which includes an ultrasound of the entire chest. It shows detailed images of the heart structure and allows the doctor to be able to see the entire heart function. A stress test or an exercise stress test is a type of test that involves raising the heart rate on purpose with exercise or medicine while performing heart tests and imaging to check how the heart responds. Cardiac catheterization, or a cardiac cath, is a test in which a short tube is inserted into a vein or an artery in the leg near the groin or the underarm. A hollow, flexible, and long tube guides the catheter in so that it is inserted into a sheath and into the body. Now, along with x-rays so that the doctor can get images of where the cath is going, the doctor threads the guide catheter through the artery until it reaches the actual heart. The pressures in the heart chamber can be measured directly, and dye can be injected. Now, this dye can be injected and is seen on an x-ray. This helps the doctor to see the blood flow through the heart vessels and valves to check for abnormalities. So from a cardiac cath, the doctor is able to see the true percentage of how well the heart is actually functioning that may not be able to be noticed during a regular blood pressure or through an echocardiogram or through an electrocardiogram or ECG. Cardiac catheterization is the most invasive form of checking the heart. And so it's usually done in emergencies, or it's usually done when other opportunities are not an option. Cardiac computerized tomography, or CT scan. Cardiac CT scan is a test used to check the heart for heart problems. In a cardiac cath CT scan, the person lays down on a table inside of this large donut-shaped machine. Don't worry, it's just a large x-ray tube inside of the machine that rotates around the body, and it collects all the images of the heart and the chest at every single angle. Now, the CT scan can show structural damage to the heart if there is any. It can also show narrowing of any blood vessels that are present as well. Cardiac magnetic resonance imaging, or an MRI of the heart, is a test where the person lies down on the same kind of table in a tube-like machine where this magnetic field produces these pictures to help the doctor evaluate the heart. It's very similar to a CT scan of the heart, and it gives these different images of slices through the heart to see the functioning of the valves and to see if there's any defects or any issues present. Now that we understand some different things about cardiovascular diseases, how they're grouped, what happens with different disease types like dilated myopathies versus dysrhythmias, and all the different pieces that have to do with cardiovascular diseases and the risk factors, let's take a look at what some of the treatments may entail. Now, heart disease treatments vary by condition, but generally use many of the following things: lifestyle changes, medications, or medical procedures, or surgery. And so we're going to talk through a few of these, but before we do, let's take a look at some things that can actually prevent heart disease from happening. Up to 90% of cardiovascular disease can be preventable if the established risk factors are avoided. Currently, practice measures to prevent cardiovascular disease include things like tobacco cessation and avoidance of secondhand smoke. Smoking cessation can reduce the risk of contracting cardiovascular disease by up to 35%. A low-fat, low-sugar, high-fiber diet, including whole grains and fruits and vegetables, are also very, very great for preventing heart disease. Dietary interventions are effective in reducing cardiovascular risk factors over a year, but the long-term effects of such interventions and their impact on cardiovascular disease events are still uncertain. Other prevention techniques include at least 150 minutes, 2 hours and 30 minutes of moderate exercise per week. That amounts to 30 minutes over 5 days per day. Each exercise-based cardiac rehabilitation reduces the risk of subsequent cardiovascular events by up to 26%. But there have been few high-quality studies to show the benefits of exercise training in people with increased cardiovascular risk and no history of cardiovascular disease. Limiting alcohol consumption is recommended as well. People who moderately consume alcoholic drinks have a 25 to 30% lower risk of cardiovascular disease. However, people who are genetically predisposed to consume less alcohol have lower rates of cardiovascular disease. This suggests that alcohol itself may not be protective. Excessive alcohol intake increases the risk of cardiovascular disease, and consumption of alcohol is associated with increased risk of cardiovascular events in the day following the consumption. Lowering the blood pressure if it's elevated. A 10 millimeter of mercury reduction in blood pressure reduces the risk by 20%, which is huge. Decrease of non-HDL cholesterol is also a way to prevent heart disease. Statin treatment reduces cardiovascular mortality by about 31%. Decreasing the body fat if the person is overweight or obese. The effect of weight loss is often difficult to distinguish from dietary change, and evidence on a weight-reducing diet is limited. In observational studies of people with severe obesity, weight loss following bariatric surgery is associated with a 46% reduction in cardiovascular risk. That's the best way to really cut your risk in half. Decreased psychosocial stress. This measure may be complicated by imprecise definitions of what constitutes psychosocial interventions. Mental stress-induced myocardial ischemia is associated with an increased risk of heart problems in those with previous heart disease. Severe emotional and physical stress leads to a form of heart dysfunction known as Takotsubo syndrome. In some people, stress, however, plays a relatively minor role in hypertension. Specific relaxation therapies and whether they're able to really benefit this syndrome are still unclear. For adults with a known diagnosis of hypertension, diabetes, hyperlipidemia or high cholesterol, or cardiovascular disease, routine counseling to advise these people as your clients to improve their diet and increase their physical activity has not been found to significantly alter their behavior and thus is not really recommended. One of the things we want to be able to do is to make sure that people are active, but that they are making certain that they're taking specific steps to reduce their risk and prevent having heart disease altogether. Now that we understand some of the preventative measures and some of the different treatments, let's take a look at what lifestyle and home remedies may be available for people to really change their lives. Some of the best ways to be able to do this to keep heart disease under control is to stop smoking if the person still smokes. Smoking is a major risk factor, and so quitting is the best way to reduce the heart disease by up to 36%. Controlling the blood pressure, asking the doctor to make sure that the blood pressure stays under control for you and making sure that it's checked often. Make sure he or she may recommend measurements if the blood pressure is higher than normal or you have a history of heart disease. Optimal blood pressure is less than 120 systolic and less than 80 diastolic. Checking the cholesterol often and keeping it in check. Make sure that your baseline cholesterol test is checked when you go to the doctors, and especially when you're in your 20s. And definitely do this when you become outside of your 20s. If the test results aren't within desirable range, the doctor will recommend more frequent measurements. Most people should aim for an LDL below 130. If you have other risk factors of heart disease, you should aim for an LDL below 100. If you're at very high risk for heart disease, you should already have had any types of heart attacks or diabetes. Aim for LDLs lower than or below 70. Keeping diabetes under control. If you have diabetes or know someone with diabetes or your clients have it, make sure that tight blood sugar control is in effect, and because it can help reduce their heart disease risk. Exercise is also one of the greatest ways, so we have to move our body. If the person has any type of heart arrhythmias or heart defects, there may be some restrictions on the activities that they can actually do because they'll become short of breath. So work with doctors to aim for 30 to 60 minutes of physical activity on most days of the week for any of your clients. Eating healthy foods and keeping healthy foods around you, especially things like whole grains, fruits, and vegetables, things that are low in saturated fat, cholesterol, sodium, and added sugar, can help control the weight, the blood pressure, diabetes, and even the cholesterol. Managing stress properly helps to reduce things like heart disease, and it helps to reduce things like blood pressure, and muscle relaxation and deep breathing exercises are a must. Dealing with depression, because depression increases heart disease significantly, and it causes a person to eat emotionally, putting them at risk for different kinds of things. Maintaining a healthy weight and being overweight increases the risk of heart disease. A BMI less than 25 and a waist circumference of 35 inches or less is the goal of preventing and treating heart disease. Practicing good hygiene is the last one, but you want to stay away from people with infectious diseases such as colds. Get vaccinated when you need to. Regularly wash your hands, brush and floss your teeth regularly, and keep your body healthy, clean, and well. Also, get regular medical checkups. Early detection and treatment can set the stage for a lifetime of better heart health.